In fact, with current Delta variant concerns growing, the CDC issued revised mask guidance yesterday, and I just got off the phone with the White House's COVID-19 task force and the CDC regarding these changes. While infections often happen only in a small proportion of the people who are fully vaccinated, even with the Delta variant, the preliminary evidence suggests that fully vaccinated people who do become infected with the Delta variant can spread the virus to others. To reduce the risk of becoming infected with the Delta variant and potentially spreading it to others, the CDC is recommending that fully vaccinated individuals to please wear a mask in public indoor settings that are in areas of highly susceptible or highly transmission areas, which unfortunately is the state of Florida. Fully vaccinated people might choose to mask regardless of the level of transmission, particularly if they or someone in their household is immunocompromised or an increased risk of a severe disease, or if someone in their household is unvaccinated. Get tested if experiencing any of these COVID-19 symptoms, and get tested 3 to 5 days following a known exposure to someone with suspected or confirmed COVID-19, and wear a mask in public indoor settings for 14 days after exposure or until a negative test result. And with a lot of conversations happening as our children are about to go back to school, including some being held behind closed doors, CDC recommends universal indoor masking for all teachers, staff, students, and visitors to schools, regardless of the vaccination status, to keep our kids safe, as we are also seeing a troubling uptick of cases among those too young to get vaccinated. These are our kids. And I know, as I have my stepson in the room, we want to protect them and we want to do everything possible. So get creative. Buy different types of masks, whether it is with dinosaurs or their favorite cartoons. This is maybe an inconvenience to them, but I'd rather it be a small inconvenience that you can make fun than at the risk of getting our children sick. So while the federal government and others are stepping up to keep our communities safe during this uptick of cases, the Florida Department of Health ceased daily COVID-19 reporting nearly 2 months ago, failing to provide daily public health information as cases in the state continue to surge. The people of Florida need and deserve access to regular, timely updates as it relates to the ongoing pandemic, not secret meetings or sporadic information sharing. We live in the state of Florida. We all know that we are susceptible to hurricanes. We all know how to prepare for hurricanes. We know that we go stock up on medicine and water and food. And if we have a threat of a hurricane, we expect daily briefings. Where is the hurricane coming? The severity of the hurricane, to make sure that we are getting prepared. Can you imagine if it's hurricane season and we have a report saying a hurricane is coming, and that is all the information that you get? You don't get any daily information of the track of the hurricane, how it is increasing in size, and more importantly, your local governments can't do anything about it. They can't help provide resources, and all you know is a hurricane is coming. That is what is happening here in the state of Florida. But we as Floridians know how to do better, and that is why I'm here today, to provide and will continue to provide the information and coordination from the federal government, filling the COVID information sharing void that currently exists here in our state. According to the CDC's latest update, Florida saw an increase of 58% in new COVID cases in the past week, for a total of 67,413 new cases. To put that into perspective, the entire United States had 306,104 new cases, and Florida alone accounted for nearly a quarter of those. And while some are trying to downplay this increase by focusing on hospitalizations rather than diagnosis, Florida's rate of COVID-19 hospitalizations also rose by more than 50%, from 7,452 admissions just last week. And we're all seeing the reports coming from our hospitals all across the state waving the flags, saying we are at capacity, and putting new regulations in for visitation. This surge is happening across all age groups, including amongst our children, not yet able to receive the vaccine, with hospitalizations among those in Florida under the age of 18 increasing by 69.8% in the past week. Sadly, there were also 358 additional Florida deaths associated with COVID-19 last week. These numbers represent our fellow Floridians, family, friends, neighbors. But the good news is we know how to beat this virus. Get more people vaccinated, as virtually all hospitalizations and deaths are amongst those that are unvaccinated. These safe and effective vaccines are continuing to provide fully vaccinated individuals a high degree of protection amongst severe illnesses, hospitalizations, and deaths. Yet only 48% of our state is fully vaccinated, which is extremely troubling. We must do our part to stop the spread of the virus. If you aren't vaccinated, roll up your sleeves and get the shots today. These can be scheduled through your doctor's offices, local pharmacies, or other convenient medical facilities in your communities. If you're vaccinated but know someone who's not, talk to them about the importance of doing so. You can share information online about local vaccine drives and combating this disinformation. If you are a community or corporate partner, help organize and promote vaccine drives or effective incentives for vaccines. We can be doing that with our friends and challenges our local businesses, encouraging and coming up with new ways inside of your own businesses to encourage your employees and other individuals to get vaccinated. Local governments, you can do different types of incentives in your communities. Have drives. I remember back in the day, we all used to have the new app of the fitness challenges. We should be doing the same thing today when it comes to the vaccine. And go back to the basics. Wear a mask. We know that that slows down the spread of the virus. Wash your hands. Be wearing, be always constantly hand sanitizing. Make sure that you're no longer going into elevators without people that you don't know, with people that you don't know. Social distance where you can do so safely. These are things that we already know. We've been living with this for almost a year and a half. We know the ways to get in front of this, to slow down the spread of the virus. Get the vaccine, which we didn't have this time last year. Go get the vaccine. It's going to slow down the spread of the virus. It's going to protect yourself. It's going to protect your family. It's going to protect your friends. And it's going to protect our economy that is so dependent on our state continuing an economic thrive that is because of these vaccines. But if we slow down the vaccines and we come to a standstill, we aren't going to be able to protect the people that are here and the people that want to come visit our state. Together, we know how to stop the spread. And so together, we need to be smart, and we need to do this together. So again, thank you for your time today, carrying this message. We are going to continuously be updating information as it comes out of the White House. We are in constant communication with the White House and the CDC and the COVID-19 task force so that we are providing the most up-to-date information because, again, information and transparency is essential when it comes to getting information out to our communities and making sure that we are working together to fight this virus. I'll take questions.
Have you made any changes for your agencies based on the latest CDC guidelines?
We are starting to look through it based on the guidelines from yesterday. We are internally reviewing what steps they are recommending, and we are always going to follow the science. And so that is where we are. We have still been doing some remote work. And so we're going to be looking at some of those policies and making sure that we're, again, protecting our employees and our consumers that are coming into our offices.
The fact that the agency is going to provide daily updates akin to what we saw from the Department of Health?
That's what our goal is, if not daily, almost daily, because, again, information is key. Information to know exactly what's happening here in the county, what's happening across the state, so that way that people are prepared with information.
I think you mentioned that there were 350 deaths in Florida last week. The Department of Health listed that number at 78. How are Floridians supposed to know who to trust when they're seeing different numbers now from your office and the Department of Health?
These numbers are based on what we're getting from the CDC. And so this is information that's being reported from the local hospitals. So we are relying on information coming from the CDC. So it's not us independently compiling any information. It's getting it from the CDC. And that has been, I think, one of our concerns from day one when it came to this pandemic is what information is out there, what is trusted information and reliable. So until we start seeing daily reporting from the Department of Health and getting these reports from the hospitals, we're going to be relying on what we're getting from the CDC.
Any recommendation to counties which are wrestling with the idea of masking or optional masking in schools?
Well, unfortunately, we all know that last year measures were put into place by the legislature not allowing local governments to do anything. So local governments are handcuffed right now about what they can do. So my recommendation to our local governments is be informative. Make sure that your local mayors and county and city commissioners are having the same type of press conferences across the state, providing information of what's coming out of their local departments of health, from their hospitals. Giving information to their local community is going to be essential too. And again, encouraging people to be vaccinated, coming up with creative ways and tools. If there's a big organization that's coming into a conference, provide vaccines at the actual location of the conference. Make sure that we know when there's going to be people coming together in large groups, make sure there's locations for vaccines. It's really important that our local governments are stepping up where they can and providing information, providing resources, providing places for vaccines and now testing again. And again, our local leaders, again, this is all about leadership. Local leaders show leadership, wear your mask. Make sure that you too, if you have not been vaccinated, that you are going out and being vaccinated and that your staff is being vaccinated. Show public support of, rolling up your sleeve and doing it in public so everybody knows there's confidence behind your local governments and your local officials that they are supporting vaccines and wearing of the masks.
Are things, or what measures, at least in your opinion, are still on the table? Are mask mandates, fines, even lockdowns? Is that something that should be considered?
Lockdowns we know should not be considered at this point. And because we need people to be smart and we need people to take personal responsibility. And if we're going to ask people to take personal responsibility, and same thing with their own businesses, they need to be given the tools to succeed, and that's information. And so I have asked for a mandatory mask mandate last year. I know that those in leadership will not do that. So we're stuck in the situation that all we can be doing is giving information out there, encouraging people to do what's right for their communities, for local electeds, for business owners, for our big corporations that are here in the state, to do what is right, show leadership on these issues, put on your mask, and come up with creative ways to encourage those around you to be doing the same thing.
For fines, would you be open to that? Do you think those would be effective?
Well, right now they're not allowed. So it's not even an option that's on the table.
To Floridians who, feel like they have done the responsible thing, gotten the vaccination, and now they're being told you're back to square one, basically.
It's frustrating. It is extremely frustrating. And I talk to my 70-year-old mother every single day who stayed at home, did everything that she was supposed to do. She went through 2 years of cancer, so she's immune compromised. And she got the vaccine when she needed to. She wore her mask. She didn't see her friends and her family. And now she's hearing friends that are getting sick again. So she is frustrated and having to put on her mask and make smart decisions. And unfortunately, that we all are taking the hit because the rest of our peers and our colleagues and our fellow Floridians didn't step up and get the vaccine. So it's frustrating. But unfortunately, this is the reality of today, and we all have to take measures to make sure that we're protecting ourselves.
Commissioner, does Governor DeSantis have a point when he says that people can't really be faulted for mistrusting the CDC when I think it was only 2 weeks ago that when they said you don't have to wear a mask if you're vaccinated, and that's whiplash, right? So does he have a point there?
No. We continue to trust the CDC based on their science. And as the science is and the vaccine, the COVID is spreading, the CDC had to make a change because they're seeing the ramifications of people not wearing a mask. And they're having to make adjustments based on what is happening in reality and in real time. The CDC, that is their job. This is a nonpartisan board, that their job is to protect America from contagious diseases. That is truly, they are scientists, they are experts, They aren't partisan, they aren't elected, and we've got to trust the science. And the problem is when it's certain leaders who've said don't trust the CDC is what's causing this misinformation and lack of trust. We've got to be basing all of our decisions on science and backing that up by listening to all experts, because we know that there's experts on all sides of this conversation at this point. But the CDC is still nationally renowned as the leading experts on all things dealing with diseases.
Characterize,
I'll get there.
I want to ask you, how would you characterize the governor's message on vaccinations? He's
Confusing.
saying that
Confusing. You know, at the first, you know, everybody applauded these vaccines coming out. He prioritized our seniors. And, you know, unfortunately, there was a lot of politicking involved with who was getting the vaccines. And then he stopped messaging on it. There was no continued messaging on the necessity of getting the vaccines. You know, this is a very simple. He could have gotten his vaccine in public to show support behind them, and he chose not to. And now we're starting to see people from his own office getting the vaccines 7 months later. So it is mixed messaging, and we need consistent messaging, which is very clear. Trust the science. Go get vaccinated.
This position that you shouldn't browbeat people into getting a vaccination. You shouldn't criticize them and just let them make their own individual decisions.
Of course, this is an individual at this point because there is no mandates for vaccines. It is a personal decision, and no one should make somebody feel guilty or you know, give them that, you know, make them feel bad about it. But there's ways to have the conversation that you have to have with your family, with your friends, with your colleagues. Say, listen, help me protect myself, you know, by going and getting these vaccines and coming up with creative ways to talk to your family members and to your friends that have not gotten the vaccine. And we shouldn't be making people feel guilty and bad about themselves. You know, people may have reasons for not getting the vaccine, whether it's other health concerns or, you know, other reasons. But we need to be having rational conversations with people. And the governor needs to be consistent on the messaging, encouraging people to get the vaccines. And the more we encourage it, the more we have open conversations and dialogues, the better off we all are.
You raised concerns last year about migrant workers and farm workers. Do you have any information on how well they're doing complying or getting the vaccines?
Yeah, we spent a lot of time once these vaccines came out. Unfortunately, the governor refused to get vaccines into our migrant communities. So unfortunately, we had to work around him and get the vaccines into some of these worker communities. And so we had a lot of pushback originally from the governor's office, but luckily everybody locally stepped up. We saw a tremendous amount of our migrant workers in these communities coming and getting the vaccines. We are out of our harvest season right now, so most, if not all, of our migrant workers have left the state of Florida, which is also why it was so important that we also got J&J, because we knew that a lot of these migrant workers were transient, and so we couldn't guarantee that if they got the one vaccine that they'd be able to have time back when they were still here. So we've seen a lot of positivity, and as I speak to commissioners of agriculture across the entire country, this also has been a huge emphasis from the USDA and other commissioners to put a priority into getting vaccines into the arms of our agriculture workers.
Will you be releasing the CDC data that you're compiling?
I'm sorry.
How will you be releasing the CDC data that you're compiling?
Well, we are hoping to have press conferences on a pretty consistent basis. And if we are unable to do a press conference on a specific date, we will be also sending out via statements from our office and making sure that we are pushing this information from all, whether it is from you all as we put out press releases through our social media outlets into our local communities. We are going to try to do everything possible to get the information out to as many different networks.
Data like from the CDC's website, or are you directly talking to CDC officials?
We are in direct communication with the White House, the task force, and the CDC.
Are you doing these weekly, monthly, daily? Depends?
We are going to do it as frequently as we feel that we need to.
For the half of Floridians that haven't been vaccinated, that they will. Because, I mean, most of these people probably are vaccine hesitant for whatever reason. A month or two ago when the Delta variant wasn't a big deal. And now with the CDC kind of changing, which they have, you know, their recommendations. I mean, I know personally some of these people that see, I told you so, that it just seems like people who are already hesitant, this is going to make them
mean, that's why we're doing this. We've got to keep trying. We got to use all of our resources and all of our tools, getting into our local communities, working with a lot of it's our rural communities. And so we are putting together thoughts on how, I get into these rural communities, have these roundtables, conversations, really emphasizing the local governments and the people that are trusted in those communities, whether it's community organizers, again, mayors, sheriffs, everybody who has access to these communities to step up. Because the only way that we are truly going to protect these communities is people get vaccinated. And unfortunately, we're seeing again that almost not 100%, but close to 95% of the people that are dying and in the hospitals are people that have been unvaccinated. And so eventually these individuals are going to know family members and friends who are in the hospitals. And it may take that to be a wake-up call to so many people. I'm hoping that we could prevent that by having very upfront conversations. But it may take a wake-up call of seeing somebody, unfortunately, around you get very sick or unfortunately, pass away from COVID before they start changing their minds.
Commissioner, you mentioned that, lockdown should be considered, but you mentioned other, like, social distancing and other aspects, not to get into elevators with, other crowds of people. Should large events with crowds not be taking place in Florida right now? I mean, should people not go to Disney and that sort of thing?
No, I think that's something that definitely needs to be considered. Not necessarily going to Disney because Disney has come up with protocols and there's things in place. But certainly we need to be looking at if in fact we're having concerts, which, I would love to go to a concert. And, that there's Dave Matthews I think will be here this week, so there's a lot of excitement for that. But we also need to have some support from these local vendors to be encouraging people to be wearing masks at the concerts or having testing locations as you walk in, or maybe it's rapid testing and vaccines. And so we just all need to start, again, being smart. People need to start looking at their own protocols from their businesses, organizers of events, and figuring out ways to do all these things safely. And if they fundamentally believe that they can't provide safety for these different events, they may need to make a decision to limit the amount of people who can participate.
Commissioner, can I ask you a question about your press release yesterday regarding the suspension of the firearms licenses for the insurrectionists? I've heard some people raise some concerns that that press release didn't directly say that these people have been arrested and charged with a crime. Can you confirm whether that is the case? Per our 790 statute, it is very clear that when somebody is charged is when we have the authorization to suspend. And so of those 22 licenses, each of those individuals have in fact been charged or arrested, which is what the nexus is. Court saying that they are Floridians, but the press release didn't say that. Are they Florida residents, or are they people out of the state who may be licensed in Florida, or a mix?
So it can be either or. And because, people that are outside the state obviously can also have one of our licenses. And so I believe all 22 are Florida residents, but I'm not 100% positive. But it gives us, they have one of our licenses, it gives us the authorization that if arrested, that they can get suspended.
I think it was 22 in total, is what it was. Are Floridians really safer because their CCWs are suspended? There are those who would contend like this could be like politically motivated.
I am doing my job. And the statute is very clear. We, all the time, are monitoring arrest records all throughout the entire state. So on a consistent basis, my team is reviewing arrest reports that are coming in because that is our job. That if somebody has been arrested, charged, and then if in fact convicted of a disqualifying offense, then it is absolutely my job, and we do it all the time. It just so happens that these are, this is more of a known group of individuals. But we do this all the time and making sure that people are safer. Otherwise, why put those statutes in place to begin with? And why making sure those protocols are in place and giving the department authorizations to do suspensions? It is just to make sure that we are safer. And that's why we do background checks all the time. And that's why it was something that I campaigned on to make sure that, while in office, every single person who applies for a permit in our office receives a complete and thorough background check. And so now we are literally doing our job in accordance with the statutes.
Or just like, do you believe that these people are dangerous on the streets of Florida?
That is definitely not my judgment call. I am following the strict letter of the law that says if, in fact, any individual who holds any one of our licenses is charged with an offense that would be a disqualifier, we are required, this is not an option, we are required to suspend their licenses. Okay. Well, thank you everybody for coming today. Please stay safe out there. If you know people that don't have not been vaccinated, have that really hard conversation. We're in this together. Thank you.